Hello, I'm Dr. Wells, creator of Nutritional Physical Therapy. I'm here today to talk to you about how to apply physical therapy with nutrition. I get a lot of questions from physical therapists about how do I integrate this into my practice? How do I help my patients? We're going to step outside the whole legal and practice act sort of boundaries and focus mostly on the clinical and some of the non clinical aspects of nutrition. So, the first thing that I tell a lot of physical therapists is think about your history. When you take a history with a patient, you often ask a lot of questions about movement or maybe social factors. So, one of the first things you can easily do is just ask a client about what's your normal diet. That can give you some insights into their dietary patterns. Furthermore, there's a really cool screen out there called the Fruit and Vegetable Screener. It's a simple one-page document, and it'll give you some major insight on how many fruits and vegetables your clients are eating. Why does that matter? Well, if they're not eating a lot of fruits and vegetables, their diet's probably filled with processed food or highly refined grains or lots of meat, which are all indicators of usually poor health, more inflammation, and likely bad PT outcomes. So, starting in the history is a good place. Another thing you can do within the history is ask about alcohol intake. Physicians, chiropractors, nurse practitioners, they typically ask these social questions. So why shouldn't PTs, why shouldn't other rehab professionals ask these sort of questions? Alcohol obviously has a major impact on recovery, performance. It can delay healing, and in our older adults, it can increase fall risk. So that is in the realm of nutrition, but it's also in the realm of every PT's examination or interview, right? So one other thing with the history is you may identify some altered dietary patterns, something that maybe stands out to you, something like the female athlete triad or disordered eating, things that need to be referred to a registered dietitian and or medical doctor. So that's some simple things that you can easily integrate into your history. As for more of a prescriptive standpoint, if you're in a state that allows a little bit more aggressive nutrition practices, you could offer an actual assessment, look at their diet, and really help that client maybe achieve some sort of disease-specific reduction in, say, like knee pain or reduction in rheumatoid arthritis flare-ups. Or if you're in a state that's a little more restrictive, you can still offer good nutritional counseling through a general assessment to help clients lose weight or just subjectively report feeling better, right? They feel more alert, they feel lighter. Those are good things, and they still will help a patient. So, the other thing with assessing a patient or prescribing a diet, you can then kind of really, again, segue back to looking at how can I refer to a registered dietitian or a medical doctor to help them see those measurable goals. So, lastly, some non-clinical things that can really be applicable are social factors, things like individuals that may be in food deserts, right? Or people that don't have the education on like what does a good meal or good dietary pattern look like. Lastly, we look at older adults too. Some of these individuals may struggle gaining access to food, right? Or they may not have a family member to take care of them. But by you engaging in a nutritional question or a nutritional assessment or screening, you may identify an older adult who's at risk and needs that registered dietitian or needs that social worker to step in. So, some other interesting things I'd like to point out is introducing nutrition makes for really fun ways for individuals, your clients, to find lifelong learning opportunities. You guys can share recipes. You can talk about different foods, different restaurants, which brings me to my last point, and that's patient engagement, client engagement, right? Instead of just laying on the table talking about the next election or talking about how bad your knee hurts or how bad their knee hurts or what's going on in sports, you can engage them on fun things like simple recipes, nutrition, good restaurants to eat at, and reinforce those good dietary patterns. So it's a good way to engage clients, not only in the clinic, but outside the clinic, engage them socially, and possibly drive some good business and benefit for your practice. So we hope you enjoyed this short video, and check out our courses at nutritionalphysicaltherapy.com, and have a great day.